have the safety belt and be on the safe side. You understand why. But I waited those 6 months, and then after 6 months, I was extremely happy to see that all implants integrated. Everything was stable. I placed 8 implants because in case like this, you say, if you lose 1 or 2, you still remain 6, and with 6, you can treat the patient. Okay, so this is why I place those 8 implants, parallel, space between implants, perfect angulation, same in the lower jaw. But the thing is now, what about the stabilization of those implants? We started from nothing, just took biomaterial. A lot of surgeons tell us that I did the same for years, that gold standard is autogenic bone graft. And I just had added this MP3, that's all. So I was anxious to see what would go there. How will be the initial stability? Shall I be able to treat this patient in a fixed restoration? You can see the X-ray of those 8 implants and 5 in the lower jaw, parallel. You can see, remember, we got 2-3 millimeters in the posterior. Look at the length of those implants. Everything is perfect. And then I decided to use Orsted because I wanted to see how stable was those implants and could I go to loading those implants. In the lower jaw, I got a huge value, which was 85. 85, you can almost hang the patient to the ceiling. This is incredible. But it's not so incredible because it's just basic basal bone. It's extremely dense. The problem of basal bone is blood supply. But I was extremely cautious when I placed the implants and everything went well. So in the lower jaw, I am on the safe side, 85. This is more than we need. But what about the upper jaw? I want to be on the safe side. So I don't think it would be a good idea to just load the implant without knowing what is there. So that's why when you do bone graft with biomaterial or whatever, and you have a difficult case, and of course, when you have bone graft, this is a difficult case, it's extremely interesting, valuable to get these values of initial stability of those implants. And guess what will be the value in the maxilla? In the maxilla, we got 77, which is incredibly high. For nothing, we started with air, I tell you, with just MP3. And we measured all implants, the other side, 77. And in all the 8 implants, we were between 74 to 78. It means that with just biomaterial, starting with nothing, we were able to create dense bone, as dense as the bone we got in the lower jaw, which is absolutely incredible. And it means that now, in a compromised case like this, if we can have this kind of results, maybe we can use these biomaterials in many cases, in many grafts, because we are on the safe side, because this is an extremely, extremely complicated case on all aspects. But this is very interesting to see that I am not going to spend my time, waste my money and patients' expectation by just gambling. I know who I am, and I know what are the values, and I know now that I am in a good shape, a good situation to continue and treat my patient in a good way.